Veterans Day is coming up, but our next guest is from a nonprofit organization that celebrates veterans all year long. The Veterans Medical Leadership Council helps Valley veterans with a variety of financial and health care needs. Here to talk about the VMLC is its president, retired U.S. Air Force Colonel Sam Young. It's good to have you here. Thanks for joining us.
Thank you very much, Ted. Good to be here.
Let's start with the basics. Veterans Medical Leadership Council. What is it?
Yeah, it's kind of an interesting name, but essentially it's a volunteer organization consisting of volunteers who are veterans who've served during time of combat that have come together to kind of give back to those veterans that need some assistance. It started in 1999, was put together essentially through the VA Medical Center, volunteers to kind of help articulate and encourage initiatives to help veterans, and then ultimately to help sponsor the parade and then follow on to help the troops that have fallen on hard times.
Was it the kind of thing where, not necessarily outside voices, these are veterans for the most part here, but was it a kind of thing to maybe just get a different viewpoint on things there at the VA?
Yeah, people that had been there and done that, it's very hard to articulate what the military is about in the civilian community, so there was some identification with that, and of course you have one large Veterans Medical Center, which handles about 87,000 patients. So the veterans can kind of talk a different language.
Indeed, and they can also help with fundraising. How much that goes on there with VA, with the patients and the programs, how much does that fall outside of maybe state and federal funding?
Well, a large part that has to do with the individual needs of the people. Say, for example, paying of utilities, or somebody's car that breaks down. Or sometimes you need to put food on the table, or you need the clothing, or whatever that happens to be. So that's one category for the actual veterans themselves. And then you also have other initiatives. For example, in the state home, we were able to put together a project to remodel the outside patio so it was safe. And we came together to help do that. There are little initiatives like that, but as you indicate, things that are outside the federal and state government
things
funding.
That kind of fall through the cracks there and that occur in the day-to-day living.
That's correct.
Some of the programs, you kind of refer to this, the Returning Warrior program, that deals with things like jobs, getting your car fixed, these sorts of things.
Yeah, the Returning Warrior program is with 911 and certainly with Iraq and Afghanistan, we started to find some of the veterans that were coming back there and were in need of support. So as that number grew from 3,000 to 6,000 to 9,000 to 15,000, we put together a program called Returning Warriors, and it's fairly unusual in that we deal directly with the social workers at the VA hospital. Now, it's all anonymous. We don't want to know who needs help and who doesn't, but the social worker works with that particular veteran to see what their needs are, see what funding is available for them. And we provide a little bit of a financial safety net. The fact that there's only 18 of us, we're able to cut a check in hours to help somebody that may be evicted, or somebody that they're shutting off their utilities, or their car's broken, they can't get to work, or they can't make a medical appointment, or something like that.
How common are those kinds of things?
Very common. Just in the first 6 months, we were able to raise and spend over $200,000 just this year. So we consider veterans, whether it's Vietnam, whether it's Iraq, Afghanistan, we reach out to all of them. But we rely primarily on the social workers at the VA Medical Center. It's a great partnership.
And for some, of course, they need more assistance than others. Support to homeless veterans, I know you're involved with that as well. And again, everything from dental care to maybe just providing a way to have a reunion with their families.
Well, that's exactly right. We work with U.S. Air. We had a veteran from World War II that was in Iwo Jima, and that he wanted to participate in a flight to the World War II Memorial in Washington, D.C., but he couldn't go because he needed a caregiver. So we were able to fund the caregiver to escort him to satisfy a lifelong dream for him.
Wow, that's fantastic. As far as community advocacy, I believe we first met with a dedication for the Herrera Way.
Sylvester
there.
Herrera, yes.
Yes, and that was there on 3rd Street. It's 3rd Street, correct?
Yes, correct.
Those kinds of things you're involved with as well.
Yeah, we really kind of reach out and touch whether, whoever needs help. For example, the stand down. There's an annual stand down that's run by a specific organization, and we help support financially, and then we volunteer to go down. And this last year, They helped almost 1,300 veterans that were essentially living on the street, homeless, or those that needed assistance, whether it's a haircut, it's a good meal, registration through the VA, whatever it happens to be.
And the state veteran home, that needs improvements too. That needs some help along the way, and you provide support.
Yeah, we go to them and say, how can we help, essentially. We were able to help in one case when they needed kind of like those special insulated covers for the meals. So we try to give back wherever we can, and in some cases we can make a difference.
I noticed as well that women veterans were a focus, and sometimes people forget that there are needs there as well.
It's true. There's roughly 46,000 female veterans in the state, and a lot of times the homeless female veterans kind of like go unnoticed. We were involved with a place called Emily's Place, and essentially that was to kind of like take an existing facility and paint some walls and work with the city and also Veterans First to put together that for some of the homeless women.
Biggest challenge now VMLC is facing, what are you seeing out there?
The challenge is that the conflicts aren't on the front page anymore, but the veterans are.
Yes.
And it's a 365-day-a-year requirement. So this coming Friday, we have what we call a Heroes One and All luncheon, where we celebrate veterans and the service that they've done. We're going to spotlight the Grand Marshals, the military Grand Marshals that have served in Korea, World War II, Iraq, Afghanistan, and also some of the active duty folks. We've invited almost 100 active duty types to come and to just have a patriotic event.
And where will this be?
It'll be at the Arizona Biltmore, and people are interested. We have our website, www.arizonavmlc.org, and we love to have them. We expect about 500 people in attendance.
And it is interesting, before you go, it is interesting, that's a great point, that when wars rage, the knowledge, the interest, the attention is there.
Yes.
When things quiet down, those veterans are still there, but the interest seems to fade.
You're exactly right.
Well, good luck with the organization. It sounds like you're fighting the good fight, as it were, and continued success. Thank you so much for joining us.
Thank you.